So we're turning this into a floor show. So we just wanted to do a quick wrap up about what it was that we heard out of the sessions this morning. So in the governance section, what we heard was we need to follow national standards to the extent possible. We need to create consistency across federal, state, and local levels of governance. There were clearly a lot of people who were not government people in that session, because that is never going to happen, but we'll do the best we can. We understand that end users want guidance on how to comply. You're not necessarily interested in helping make the rules. You just want us to give you the rules so you can follow them. We can do that. And that planning should be driven by real world use cases. That again will be a first in healthcare, but we'll try to get that done too. So we did our this really is dinner and a floor show. So we did a couple of polls. What were the top 2 items on the short-term priorities? Health information, legislative exchange, clearly it's time for us to end this session. Legislative harmonization and health information exchange participation agreements. And then the medium-term priorities are health information exchange to health information exchange participation agreements, nationwide health information network onboarding support, HIE accreditation program. And the good news is that this played out pretty closely to what we thought was going to happen. And the good news for that is that eConnect and CHHS are on the right path, and we're doing what you're asking us to do, so that's a good thing. In the coordination session, what we heard was more communication, and it needs to be coordinated communication on health information exchange status across all elements. Stakeholders want to know when and where to plug in, and they want to be able to plug in. And stakeholders want to hear progress of the state activities, such as the immunization registry and other things that are happening at the state level so that they can take advantage of them as well. Related specifically to the PIN priorities, they want us to help to provide forums specific to working on accomplishing the priorities for e-prescribing, lab results, and summary of care and public health reporting. They want us to update the eConnect website regularly and send out email alerts. Sorry, we've been directed to address our technical issues. Here you go. Are we done now?
No.
Okay.
But go from here.
All right. It's a technology event. Something like this had to happen before the end of the day. We also hear that stakeholders believe that the summary of care document is the most important priority among the existing ONC requirements. There was some additional feedback. Stakeholders want to hear about grant opportunities or other funding sources available to them, including they want us to include behavioral health stakeholders. They want us to improve existing EHR tobacco modules so that it actually accomplishes what we need it to accomplish. And they want us to direct stakeholders to appropriate or existing user groups so that we don't have to reinvent wheels. In the coordination poll results, the top 2 items on the which following information would benefit you most are communication on the status of California health information exchanges and communication regarding all HITECH Act grant opportunities. We heard that what communication vehicle would be most useful would be email, as well as regularly scheduled webinars, and which efforts are most important to your specific goals, the summary of care document, and improving or advancing the exchange of lab results electronically. In the technical assistance area, we heard that the challenges and barriers were money, clarity on health information exchange and other definitions, return on investment or business cases, standards and interoperability, and sustainability post the stimulus funding. And the kinds of things that they're looking for from us are grants, toolkits, standards endorsement, ratings. They'd like us to have an Angie's list of health information exchanges, security guides, consulting services, education geared to different audiences and focus on the needs of individual providers. The poll results tell us that So in this session, we asked what was critical for technical assistance, and what we got was technical assistance to community HIEs and providers, and standards interoperability. Less important were nationwide health information network onboarding, non-conflict of interest exchange services, and a test harness environment. In the Regional Extension Center session, the role of the Regional Extension Centers was sharing data should not be a competitive advantage. They said don't hold data hostage. I have a friend who says, data wants to be free, man. eConnect and the Regional Extension Centers need to facilitate connections with local health information exchanges. We need to facilitate communication between vendors and HIEs. Regional Extension Centers and health information exchanges must coordinate outreachers so providers aren't confused or overwhelmed. There is absolutely a Tower of Babel out there, and we need to resolve that on all areas. We need to help assure that the HIE spigot is turned on in the provider offices, and we need to expand workforce education to include health information exchange, not just electronic health records. And in the state government usability of how state government can use health information exchange to meet data needs, what we heard was eConnect can play a role to improve data coordination between states and counties, that we can help address concerns over data use, we can simplify, streamline, and consolidate. Well, that the state would like to have a not us, that we would like to have simplified, streamlined, and consolidated state reporting requirements. We would like to deliver data electronically to state systems. We need to provide education on appropriate electronic data use. And we need to support and clarify opportunities that support health information exchange development and participation. So in our poll results, what we saw out of our audience was that 2 out of 3 see the opportunity to work with eConnect to define potential solutions for existing challenges, and that the kind of information their organization would need would be 50% of them said clinical and administrative, and then 16% each was clinical only, administrative only, and admin and clinical de-identified. Some interesting results. The technology emerging standards session. The priority for the next step of the state interoperability project were key use cases are the ability to pull patient history and medication history, the identified transactions or EHR to HIE exchange, lab orders and results. The reference implementation that they want to participate with is the cross-community patient discovery. There is a website at the bottom of this. It's the interoperabilityworkgroup.org. And this work group actually came out with a set of standards that have been endorsed by, I think it's something like 9 states, several HIE vendors and EHR vendors. We're trying to consolidate and make real standards. And this group is at the leading edge of this, and there is information about this work group on our website. So finally, what did we really hear today? And this is the summary. We had great interaction and conversations. We heard a real commitment to continue to participate, also with the understanding that we have to have results at the end of the participation. We need to make progress. We got very positive feedback on the California Health and Human Services Agency and eConnect direction, and we got good feedback on business cases for health information exchange. So it's been a phenomenal day. And your participation and the participation of those who are no longer with us has been made this an extraordinary event.
And I'd just like to echo what Laura said. Really, the participation from all of you here and all of those that have been here throughout the day have been phenomenal. We obviously heard that there's excitement, that there's motivation and energy as we move forward and continue the transformation in California and the revolution to change the way we deliver health care. We know we have challenges, we know we have opportunities, We have ways to deal with those. We have a lot of creative minds, a lot of folks ready to think outside of the box, think about different ways of doing things, and we do have a really solid amount of seed money that's helping us make this happen. So we really want to use it effectively, use it in a prioritized way as we keep this transformation going, how we also make it grow by working with other activities so that we really take advantage of it. And we really heard a lot of positive energy around that. So we're looking forward to being in very close contact with all of you. Lots of people have asked about the slide presentations. Those will be added to the eConnect website as well as the ehealth.ca.gov website, our web portal for the state. We will, I'm not sure exactly when we'll get those up, but we will be working on getting them up in the next couple of days. We have a monthly stakeholder call the second Thursday of the month, which is actually Thursday in 2 days from now. So we'll be providing some highlights from today's meeting as well as some of our regular updates on that. And that will continue every month. Dependably. So please, if there's folks that want to hear about what's going on in HIE and high tech and the different programs, we welcome you to join those. And then there will be many other opportunities to get engaged. One of the things that we have heard from a number of different arenas is that people are interested and are looking to be working together. So eConnect will be leading a number of those efforts. We'll be working together with eConnect and CHHS as well as all of our other high-tech grantees. I mean, and I really, the regional extension centers have done a tremendous job with a fantastic network throughout the state, really reaching out and being on the ground with our providers. The work with our EHR incentive program, getting the funding rolling out, has really obviously gotten folks' attention, and we're really proud of that taking off. And really, there's only 33 states that have launched their programs. So there's quite a few states still working on it. So that we're really in a good place there, moving ahead with that. And all of the other work, whether it's the broadband, the telehealth, the workforce, lots of components, the different kinds of interactions. We're really thankful for all the work that you're doing now and are continuing to do with us, and look forward to participating with you. So please stay tuned on our websites. Look for our emails. Send us notes. We have contact information on the CHHS website, the eHealth portal, as well as the eConnect website. Let us know how you want to participate. So thank you for being here. We did want to spend a few minutes to see if anybody else has some closing comments, thoughts, reflections on the day before we close out. But I wanted to make sure we covered a few of those logistics. Any comments or closing thoughts? Great, thank you. And I want to just again recognize all the people that really came through on the planning and putting this together, the behind the scenes work. It was a tremendous amount of teamwork, to the sponsors, to the exhibitors. Thank you to everybody for being part of it, leading sessions, and coming to Sacramento. So thank you, and have a fantastic Thanksgiving holiday.